Hi, I'm Dr. Roth with Arasti, and today we're going to be discussing frozen shoulder. We'll be discussing the causes of frozen shoulder, the signs and symptoms that may indicate you have this condition, and how traditional healthcare manages it, and how Arasti is a little bit different. Let's get started. So frozen shoulder is when the tissues around the shoulder joint capsule thicken and tighten, limiting the range of motion of the shoulder joint. Now let's talk about the causes of frozen shoulder. There's two types of frozen shoulder. The first one can occur after trauma, where there's scar tissue that builds up in the shoulder joint capsule. The other type, we're not totally sure what causes it, but we typically see it in women over the age of 40. Now let's talk about the signs and symptoms that may indicate that you have frozen shoulder. Pain usually starts on the outside of the shoulder and moves progressively deeper into the shoulder joint. You may have some difficulty moving your arm through its full range of motion. You also may have some pain sleeping on the affected side, some difficulty getting dressed, and grooming. Now let's discuss how traditional healthcare approaches frozen shoulder. They may prescribe pain medication and oral steroids. They may also perform corticosteroid injections directly into the shoulder joint capsule. And in some cases, they may recommend surgery. Now, let's discuss how Arasti is a little bit different. At Arasti, we spend a full hour with each of our patients at every visit. We perform a thorough evaluation to get to a proper diagnosis so we can get to the root cause of your pain. We treat you with specific, hands-on manual therapy followed by active care with stretches and exercises you can do at home to maintain the progress you've made in the office. We hope the information presented to you was helpful. If you or someone you know is suffering from frozen shoulder, click here to schedule an appointment with Arasti today. If you'd like to check out other videos, click here, and don't forget to subscribe to our YouTube channel. Thank you for watching, and we'll see you in the next video.